Brachial plexus. Brachial plexus is a somatic nerve plexus formed by intercommunication among the ventral rami. So what is the ventral rami? We are looking at the TS of the spinal cord, and this is the thoracic segment. This is the ventral rami. So ventral rami of lower 4 cervical nerves, that are C5, 6, 7, 8 and thoracic first segment. First thoracic nerve. Plexus is responsible for the motor innervation of all the muscle of the upper limb with exception of the trapezius and the levator scapulae. It supplies all the cutaneous innervation of the upper limb with the exception of an area near the axilla. Now, formation of the brachial plexus. The brachial plexus is formed of the ventral rami of spinal nerves C5, C6, C7, C8 and T1. It is divided into the roots, that is C5, C6, C7, C8 and T1. Now, that forms the trunks. Shortly after emerging from the intervertebral foramina, they form the trunk. So they form the 3 trunks. The 5 root unite to form 3 trunks. Ventral rami of C5 and C6 unites to form the upper trunk, C7 forms the middle trunk, and C8 and T1 unites to form the lower trunk. Now, each trunk splits into the anterior and the posterior division. Each trunk splits into the anterior and the posterior division. So from 3 trunks there are 6 divisions. The anterior division of the upper and the middle trunk unite to form the lateral trunk. The anterior division of the upper 2 trunk unite to form the lateral cord. Lateral cord. The anterior division of the lower trunk, forms the medial cord, and all 3 posterior divisions unite to form the posterior trunk. Remember, at this point, anterior trunk usually supplies the flexor muscles and posterior trunk usually supplies the extensor muscles. So now posterior trunk unite to form the posterior cord. So there are 3 cords called lateral cord, medial cord and posterior cord. Lateral cord gives rise to the musculocutaneous nerve. Musculocutaneous nerve. Musculocutaneous nerve innervates the muscle of the flexor compartment of the arm. carries the sensation from the lateral side of the forearm. Now comes the ulnar nerve. Ulnar nerve is formed from the medial cord. It innervates the intrinsic muscle of the hand. Ulnar nerve. Intrinsic muscle of hand. It supplies the 1.5 digits, that is thumb, first finger, second, third and fourth. So it supplies, the ulnar nerve supplies the little finger and half of the ring finger. Median nerve. Median nerve is derived from both the lateral and the medial cord. So median nerve is the main nerve supplying the flexor compartment of the upper arm. Median nerve, what does that supply? That supplies it has the motor innervation, most of the flexor muscle in the forearm, intrinsic muscle of the thumb, carries the sensory innervation from the. So now this was left, that is the thumb and thumb plus 3.5 fingers, 3.5 digits. The posterior cord. Posterior cord usually supplies the extensor muscles. So there comes the axillary nerve and the radial nerve. Axillary and radial. Axillary nerve forms from the posterior cord, supplies the motor innervation to the deltoid, teres minor and it carries the sensory innervation of the skin just below the point of the shoulder. The radial nerve supplies, as the name suggests, it is a great extensor nerve because it innervates the extensor muscle of the elbow, the wrist and the fingers. Sensory innervation from the skin of the dorsum of the hand and the radial side.